I'm Michael Smart. I'm an economics professor at the University of Toronto. We're in an interesting time now in that the CHT and CST, major federal transfers, are about to be renegotiated between the federal government and the provinces. Not that many Canadians focus on this, but it's a big program of big importance to these governments. It's about $40 billion in total in cash that's funneled from the federal government down to the provinces to nominally to pay for healthcare and other social services. The debate that seems to be emerging now between our first ministers is about how fast that $40 billion envelope should grow in the future. Should it grow at 6% or should it grow at some lower rate, for example, maybe 4%? Now, it seems to me that that debate's going to happen, but it's just not the right question for our governments to be asking. The nature of this program is it's really just an accounting arrangement between two different branches of our government as Canadians. And it doesn't really matter whether there's more spending on this program at the federal level, higher federal taxes imposed on Canadian citizens, but correspondingly lower provincial taxes imposed on Canadian citizens. Or we go the other way and we shrink these programs and we end up with lower federal taxes, higher provincial taxes, but pretty much the same outcome in terms of how much gets spent on healthcare and social services going forward. So I'm a little disappointed that we haven't seen a broader debate about what this program is for and ways in which we could reform it so it better met the needs of Canadians going forward. So I'd like to think that we might see some changes. One change that, for example, that could be considered is to make a fundamental change in this program. Instead of saying that it's a federal cash transfer to the provinces, the amount of which is to be negotiated every 10 years, as we do now, we could simply say, let's take one big federal tax base. For example, the GST now raises about the same amount of revenue as the federal government spends on the health transfer. So we could take that federal GST and just say, that's the federal money for health transfers to the provinces going forward. It would still be a federal tax, and the provinces would still get cash in the same way they do now. It's just we would all agree that that tax was the amount the federal government was contributing. And I think that that would be it would make very little difference in the day-to-day operations of the system, but it would change the way in which Canadians and Canadian politicians think about this system. It would no longer be possible, for example, for a premier of one province, as several have in the past, it wouldn't be possible for a premier to say, I want to see federal transfers growing at a higher rate because we need that money for healthcare. Instead, premiers would have to say, I believe that federal taxes should be higher, that all Canadians should pay higher taxes to the federal government because we need that money for healthcare. And that's a very subtle distinction, but I think it would change the way in which we talk about this, and it would bring up the fact that there is a budget constraint in this program, and that all taxes, whether federal or provincial, are being paid by some Canadians eventually. So it's kind of a small change, but I think one that would fundamentally alter our thinking about these issues, and it will allow us to set aside these squabbles between federal and provincial orders of government, and I hope focus on important things like the quality of health care for Canadian individuals.